Very often people say that they drink little water, they try to drink less water because they have swelling. They believe that it's because they drink water that they have swelling, but they already have swelling even without water. So why drink more water then? And often they also mention the heart problems or heart failure as the reason. Well, swelling is actually a manifestation of heart failure. They say, I have a bad heart, so I drink less water. They say, come on, if I drink a lot of water, my heart is already in bad shape. It's already hard for my heart. So why drink more water in such cases? And many even say, yes, my doctor forbade me. He said not to drink more than a liter of water. You have a bad heart. With your heart failure, you shouldn't drink water at all. But is that really correct? Guys, let's figure this out because it seems like everyone is doing exactly the opposite of what's right. Look, swelling in a person is not just water. In reality, fluid or water in the body, in the blood vessels, in the intercellular space, and in the interstitial space is retained only if there are osmotically active substances present. I call them salts, but the word salts is in quotation marks. This term isn't used in medicine. That's not the same salt we use for seasoning. These are metabolic byproducts. Essentially, urea, uric acid, creatinine, and all that other junk that should be excreted by our kidneys. So now consider this. When a person's kidneys are unable to properly and effectively cleanse the entire body, all these accumulated and harmful salts regrettably remain present both within the bloodstream and deeply embedded within the various tissues. And remaining in the tissues, sometimes called toxins, they create this osmotic pressure that retains fluid. And because of this fluid retention, a person develops swelling, edematous tissues. And now look, when a person drinks little water, because of this lack of water, the kidneys can't remove all these salts from the body. And since these salts are not eliminated, they retain the remaining water, and the person develops swelling. But the swelling doesn't occur because they drink water, but rather the opposite, because they don't drink enough water. And that's the problem. The person says, I already have swelling. Why should I drink even more water? But when someone with swelling finally starts drinking water, their swelling decreases because the kidneys begin to flush out the salts that were previously retaining the water. Therefore, to avoid swelling, you actually need to drink water. And you shouldn't drink too much or too little water. You need to drink as much water as your kidneys require to cleanse your body. For the kidneys to be able to flush out salts from 30 kilograms of body weight, they need 1 liter of water per day. Obviously, if you weigh 150 kilograms, you need to drink 5 liters of water. There's no other way. How can your kidneys cleanse your whole body with the amount of water you're currently drinking? Of course they can't. And that's when people start having problems with swelling. Now, regarding the heart and heart problems, people say, my heart is already weak, I have heart failure, which shows up as swelling, shortness of breath, and tachycardia. So why should I drink even more water? That would just overload my heart. Well, let's figure this out then. When we drink water, it gets absorbed from the stomach into the bloodstream. After that, plain water doesn't move from the stomach to the intestines because the sphincter is closed. The pyloric sphincter at the exit of the stomach only opens when the acid-base balance in the stomach changes, which happens when we eat. But when you drink water, it basically doesn't go beyond the stomach. It is already absorbed directly into the bloodstream within the stomach, effectively diluting the blood, and consequently, the blood becomes noticeably thinner and much more fluid for the individual. When someone drinks little water, their blood is thick. When they drink a lot of water, the blood becomes thinner and more fluid. And when a person's blood is sufficiently thin and wonderfully fluid, it's significantly easier for the heart to efficiently pump it throughout the entire body. However, when a person unfortunately experiences heart failure and consistently drinks very little fluid, consuming only minimal amounts of water, their vital blood inevitably becomes highly concentrated and much thicker. The hematocrit level is elevated, and it's hard for the heart to pump such thick blood, which leads to worsening symptoms of heart failure. But when a person starts drinking more water, their blood gradually gets diluted, and it's much easier for the heart to efficiently pump this more diluted blood. And as a direct result, the uncomfortable symptoms of heart failure noticeably decrease because the person is consistently drinking sufficient water. But then why does the doctor forbid it? The doctor forbids it for a different reason. The thing is, when a person has certain heart problems, like left ventricular hypertrophy, heart failure, or cardiac ischemia, they have a constant need to see a cardiologist and to regularly take certain chemical drugs, pills, and medications that they buy at the pharmacy. And both of these things benefit the doctor. But if a person with heart problems starts drinking more water, it becomes easier for their heart to pump and to function. Their symptoms of heart failure decrease, and the strain on the heart is reduced. As a result, the person has less need to see a cardiologist and less need to use pharmacy products. And that is not profitable for either the pharmacy or the doctor. That's why the doctor recommends drinking less water, so that the person gets sick more often and comes to see them more frequently. That's exactly why I always say, if you want to have a healthy heart, drink more water. But what does more mean? You shouldn't drink more or less water than you need. Drink as much as is appropriate for your body weight.